Hi, my name is Monica Acosta, and I want to discuss with you all today the benefit of moving toward a value-based model of care within our system. The traditional fee-for-service payment model can alter incentives for better care because it is focused more on quantity rather than quality. Things are changing in our society, and the community is more focused on helping people and being patient-centered rather than making the most money. We rely heavily on reviews from patients because they provide the ability to change the minds of those who come to use our services. Value-based care shifts the entire focus of healthcare delivery from focusing on inputs like procedures and product to outcomes like measurable quality and cost improvements in the health of individuals and the population they are part of. Value-based care focuses more on the quality of care and the outcomes of that care. Better outcomes also reduce spending and decrease the need for ongoing care. By improving patients' health outcomes, value-based care reduces the complexity and disease progression that drive the need for more care. For example, a patient whose diabetes does not progress to kidney failure, it does not progress to blindness or neuropathy, is, over time, much less expensive to care for than a patient whose condition continually worsens. Our practitioners would be reimbursed based on the quality of the care they provide, instead of the number of services that they perform. This type of reimbursement will encourage our practitioners to provide high-quality care to our community. Choosing to move in this direction will allow for better collaboration with our partners and medical constituents and make for a better experience for our patients. Less mistakes will be made because the same information on a patient will be adopted by every member of their care team due to this new collaboration. This should also be less of a burden for the patient because they should only have to update their records once, no matter what doctor they go to. That ultimately is less work for both the patient and the practitioner. The patient's needs will not only be known, they will be anticipated. Adopting this model will not only lead to better patient outcomes, but it will also lead to lower healthcare costs for our facility and for our patients. This is because reimbursement isn't based on the number of services and procedures provided, so there shouldn't be so much overutilization like there is now. A value-based care system will change the approach of care and can empower patients to be more active participants in their own health at home with connecting care technology. This model should also encourage population health and preventative care, which overall will help reduce long-term costs and increase quality and outcomes. Now, the transition from fee-for-service to value-based care can be difficult because it requires an investment in new tools, IT infrastructure, and additional administrative staff to help oversee and coordinate the changes. It is also a big change in how facilities have been operating for so long, so it will take some getting used to, just like any other change, but it is a change for the long run. Providers being compensated for providing valuable care rather than charging for services ensures that people aren't getting unnecessary testing and that patients are being viewed based on their health and not how much a provider can make off of them. Improving a patient's health outcomes relative to the cost is an aspiration embraced by stakeholders across the healthcare system, and that includes patients, providers, health plans, employers, and government organizations. Value-based care will overall create a happier and healthier community, increase patient satisfaction, increase patient participation, and better prevention techniques. By engaging in population health, overall cost, quality, and outcomes will improve. Creating a system that cares more about the outcomes of a patient, focuses on the community, and collaborating with others will create a better functioning system. Once implemented, it will ultimately make delivering care easier for both the provider and the patient. It will also encourage providers to deliver care how they were meant to while continuing to make a profit. In an era where a review is everything, this is the best approach to maintaining quality care that patients will talk about and want to experience for themselves. Thank you.